You must add significant value to your clients' lives to achieve outrageous success. The left ASS is low, the left PSAS is high, then it's a flexion disorder. And we need to bring those bones back into place just by tractioning and loosening muscles. So we know the psoas muscle, which we already worked, would be tight. We know the iliacus muscle, which we already worked, is tight. And one of the quadriceps, the rectus femoris, attaches to the ilium and goes down to below the knee. So we know that that muscle will be tight as well. We need to loosen off the SI joints. So when she was face down, we would have worked the ligaments a lot. We would have worked the SI joints, all the soft tissue in there to help release that. And then we would want to use her hamstrings, which attach to the ischial tuberosity, the back bottom of the pelvis. And by bringing her leg up like this, and if her hamstrings are tight enough, it will traction on her pelvis and bring it back more into extension or out of flexion.
I really like, you've been practicing for over 20 years, right? I've been practicing for 7. You're brand new.
For a few months already.
A few months already. So what I think was great about yesterday is the way that you presented it. I mean, this is it's specific work, but we could all jump in and really get something out of it and all get something that I think we could probably just start using right away. So I think that's really neat because not a lot of classes offer that, where it feels like everybody at all different levels could just understand it and, take something to use.
Now, if when you loosened off all the soft tissue, things didn't normalize, we need to traction that hip and we need to traction those iliums together. By pushing in on the ASISs, you see how the back opens up? Too much. But I could also press down on this leg if it really came up. That would give a really nice movement. And actually, as you hold that, it's not in any way, shape, or form a chiropractic move. You're just gently tractioning those bones that are kind of stuck together, and they will just move very, very nicely into position, probably 80% of the time on the first try. Now, the next thing we want to do, remember there are 3 joints in the pelvis. There's the SI joint, the other SI joint, and then there's a joint right at the pubic symphysis. Now, if that is not sitting correctly, and you'll see that on x-rays, I'll maybe put a picture of that in the film. What I'm going to do is have her bring her feet together and bring her knees apart, and I'm going to put my elbow and my forearm basically between her knees, and explain what I want her to do first. I'm going to have her pull her knees together without hurting herself as hard as she can. Go ahead. And did you feel that? Yeah?
Yeah.
Her pubic symphysis just adjusted, so it was not in the right place. So that was a real good move.
Sure.
After I did the work on the pelvis to stabilize, I'd have her bring her knees up. I'd have her lift her pelvis up off the table, set it down again, and then put her legs down. And now I would measure. Because I may have pushed her into a different position to deceive myself into thinking that I corrected it.
My name's Katrina. I am a physical therapist assistant, and I learned so much over the course of this weekend that I'm very excited to bring back to my clinic and teach them as well. Definitely things that we were never taught in school because you don't have too much time in school to learn as in depth. And I think that a lot of this is going to be incredibly beneficial for a lot of my patients. And so I went to my boss and we looked at a few different ones, and she agreed with me that this was definitely the best one to take out of a number of them. And I'm very glad that I did because like she told me not all of these are going to be great, you're not going to get what you need out of all of them, but I got more than expected out of this one.
Quick refresher, obliquity is when one ilium has gone in and the other one has gone out, or in flare, out flare. And if you look at these holes around the ischial tuberosity, you can see that when one goes in, the hole actually looks bigger, and when one goes out, the hole actually looks smaller. So again, I'll put an x-ray picture-in-picture on the screen, and you can see what that would look like in real life. Somebody brings you in an x-ray. So what do we do for that? The muscles that are pulling the one into inflare would be the iliacus. Although most drawings don't show it, those iliacus fibers, some of them actually cross the SI joint. So they can pull in like this. And on the one that's outflared, it would be more the gluteal muscles that would cause that. So on the inflared side, treat the inside of the hip, and on the outflared side, while they were still face down, we would do those glutes. These iliums also talk to the temporal bone, so if we were going to be a little more complicated, we'd also be doing exactly the opposite on our temporal bones on our skull. And I have a great x-ray, which I'll put up, of a patient who had obliquity, and because she was out of town, we took another x-ray when we were finished working, and you can see the obliquity is completely gone in an hour. I can't say that that's a typical case, but you can see that you can do some amazing things if you know how to apply these principles and you have the confidence to use them. I had an interesting case with my mother, who is now 97 years old. She had pain in her legs and was misdiagnosed with sciatica, in my opinion. And when she flew down to Florida and I worked on her, all of the things that usually cause sciatica or typical sciatic symptoms, the pseudosciatica, were all clear. Turned out it was her kidneys and her bladder. The 2 sessions, all of the pain in her legs were gone. Now, I don't understand exactly how the organs were causing the pain in her legs, but with 2 sessions of working on her organs, the pain was completely gone from her legs. So if you can learn to think outside the box and use your imagination, you'll help those people very often that no one else seems to be able to help. Now, very often those kidneys will fire neurological signals into the quadratus lumborum. You find people who are where their pelvis is level and their upper body is going off to one side. There's a scoliotic pattern. And sometimes you'll find that hidden source of proprioception is the kidney that's causing the problem in the QL. The bladder, of course, is right above the pubic bone and in behind it. And in this position, gravity pulls the bladder out in the most accessible position.
Merrill is so very articulate in what he wants you to do, and the demonstrations are supreme to any of the classes I've ever been to.
Okay, we've drawn on the sacrum here and the iliolumbar ligaments, and of course there are ligaments right on the sacrum, no muscles, and we need to treat those. They stabilize the SI joint, they stabilize the whole area. So we're going to treat in this sort of a pattern. We'll go right in and treat those areas. So now I'm going to go out a ½ inch and treat. I'm going to switch over because this tool is actually much more effective. And as you work your way down, you'll feel like right there's a tender spot probably, or a tight spot at the very least. And about 1 inch over from the PSIS, you'll find that iliolumbar ligament. I'm going to put a little lotion here. It's probably going to smudge everything. And we're going to treat along the SI joint here, treat all the glutes, the piriformis, and then the tensor fasciolata. First of all, we're just going to warm everything up. And any trigger points that we find, I could even take this, for example. Okay, I wanted you to see what rotation looks like. So if her right hip goes forward, go ahead, okay, and rotate again. So when the pelvis is rotated, it's actually in this case, a right external rotation in the femur and a left internal rotation in the femur. So it's very important that we make sure that she's standing in the correct position. Leg length evaluation x-ray is completely worthless unless she's standing in the correct position. See, we've simulated a low PSIS on the left and a high on the right, and you can see the vertical string and what her spine is doing. It's going over here to the left and then doing a little dance back, and her shoulders are definitely not level, and she's getting cramps just simulating this. So you can imagine the people that you see that come in and actually look like this, what they feel like. We need to see the tilts, lateral, and we need to see on a vertical axis the rotations, and now we need to see anterior posterior. We'll show you that next. Okay, and here we're showing a bilateral flexed ilium, meaning that when I put my fingers on the PSIS and the ASIS, we can see here that she's about 30 degrees. And she should be at about 5 to 10 degrees. And of course that gives you this deep curve in the back, and then it'll usually flatten out the upper back here. This pelvic upper leg workshop will equip you to supply far superior treatments to your patients while saving your hands and extending your career. People will always need to get out of pain and be willing to pay for it, unlike pampering massage, making your practice indispensable. I know that purchasing this class will add significant value to your practice. Thank you for visiting the Career Extenders website.